Megan and I have been working together for so long. We have clients that will see both of us. We have clients that have started with me who moved to her, or vice versa. It's just, it really depends on you. Once you get into that chair, you have to feel comfortable with whoever you're sitting with. And there are Google reviews. You definitely want to kind of research. If people post befores and afters, look at their work.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Angela Cutler and Megan Werth of Sakun the Spa. Angela has 10 years of previous experience as an ICU nurse and a family nurse practitioner before transitioning to aesthetics, where she spent the last 15 years specializing in her passions: injectables, laser therapies, anti-aging techniques or technologies, and skincare. Angela is laser certified and trained in treatments like microneedling, laser hair removal, and more. She's also skilled in female sexual function therapy, including pellet hormone therapy, O-shot, and Mona Lisa laser, continually advancing her expertise to serve her clients' needs. Megan graduated from Clarkson College with a Bachelor in Science and Nursing in 2007 and spent 6 years at Nebraska Medicine in orthopedic surgery, working in various OR specialties. After having 2 daughters, she shifted to a slower-paced yet fulfilling career in medical aesthetics, inspired by her own experience as a client. With 11 years in this field, Megan is passionate about helping others feel confident while looking their best, and she can't imagine doing anything else. So Angela and Megan, welcome, and glad to have both of you here.
Thank you.
So let's dive right into it. How did you first get interested in aesthetics?
All right, I'll start. So just after being in the hospital for so many years, it can especially doing intensive care and stuff, it could just kind of wear on you, So I always knew that I wanted to stay in the healthcare industry, and aesthetics has been just booming lately, and it's always intrigued me. And not only was I intriguing for myself, but it's just something that I really wanted to learn. And I really love making people feel good about themselves. So I was just ready to take my career onto a whole new level.
And I kind of echo that, because I spent a lot of time in the hospital doing some pretty crazy, life-saving, amazing surgeries. But I had a husband and a family, and my husband traveled a lot. And so I myself was a patient. Angela took care of me. And at that time, I had a bachelor's degree in nursing. And I just said, I didn't know nurses could do this, and she's like, absolutely. And I said, well, if you're ever hiring, let me know. And she said, well, what do you know? I'm hiring. So come interview. And so I interviewed a week later, and the rest is history. Now we've been together for almost 12 years.
Wow, long time. It's a great story about how you both got into it. Now, I want to dive a little bit more into the treatments that you offer. Now, in the introduction, that you both do a lot of different things, but can you discuss some of the most common treatments that your clients and patients come to you for, and also why do you think that they're so popular?
Well, I would say, I don't think we do one treatment more than another. It seems like in our schedule we've got kind of a variety, but I would say our injectables are probably the ones that people come in the most, like our neurotoxins. So we carry Botox, Dysport, and Jabot, because there's a toxin that works for everyone, and we kind of treat those as more of like the gateway, because for other patients to come in so that they can learn more about some of the treatment modalities that we offer.
Yeah, I would say we, Angela and I, have been really focused on full face anti-aging and rejuvenation with injectables. We really pride ourselves on that luxury standard. And so we've done a lot of continuing education, including cadaver courses. We're constantly trying to elevate our practice there. So we really like to look at the whole entire face. So we're not treating just specific areas. We look at everything as a whole and how we can help our patient with injectables and other modalities too.
Got it.
But I think what sets us apart too is that we actually come up, like what Megan said, it's like a whole facial, because you have to look at the face as a whole instead of just in areas. And we kind of come up with a specific treatment plan for our patients. So if they come in like, yeah, we can address your wrinkles with some neurotoxin, but then, well, what are the next steps? So we can come up with like anywhere from like a 6 month to a year plan to get them to where, you know, they specifically want to be as far as aesthetics.
Got it. Now, are there any new or emerging treatments that you're particularly excited about? I know there's some other ones aside from the injectables, but that I mentioned in the introduction, but are there any ones that's really capturing your attention?
So we love new treatments, you know, and we're the first ones to try everything. We'll put it on ourselves before we even get it with our patients. But
sometimes it doesn't always go in our favor. So if it doesn't work out, we will probably not bring that specific treatment on.
Right. But we definitely love, you know, the PDRN and platelet-derived growth factors, and really looking at biostimulation through different technologies, whether it's using our own bodies or plant-derived or salmon sperm, you know, all the different ways to rejuvenate. There's a lot to be said about the history and science behind it. It's just in the United States and specifically Nebraska, we're always a little bit behind as far as our FDA approvals go. So I think we're really excited about those.
Mm-hmm. Yeah. No, 100%. Because there's, you know, it seems like every corner you turn around, there's something new. Oh, this is anti-aging. This is anti-aging. But what we really do is we really try to do our research. And like I said, it's the companies can say, oh, this is the best. But once we actually get it in here, we've brought in products and we've taken them out, you know. So we really try to find the ones that are really going to work for our clients. And I think one of our favorite new ones is like what Megan said, is the REScence platelet-derived growth factors. So we can use that with microneedling, and we've had really great results with tear trough injections and really rejuvenating the under eye, which seems to be one of the hardest things to really get to rejuvenate.
Mm-hmm. Got it. Now, all these treatments are falling under things like regenerative medicine, functional medicine, which I've actually been seeing a lot of practices starting to bring these treatments in. That's kind of like the new cutting edge treatment that's out there. So for people who don't understand or don't know what it is, like if you had to explain it to a fifth grader, what is regenerative medicine, especially in how it relates to aesthetic medicine?
So, you know, it's this type of medicine's been around forever, and they use it. I feel like most of the times we see it in either like oral max or, you know, orthopedic surgery, oncology, things like that. And then somehow it kind of starts to weasel its way over to aesthetics. And so it's really proven itself in different medical areas. And then, you know, and then somebody just decides to try it in aesthetics, you know, and sometimes it works and sometimes it doesn't. So I think the biggest thing was PRP and PRF. And those are beautiful treatments as well, but it's hard to find consistency with it because it's coming from a patient, and we don't know, you know, hormonally, genetically, lifestyle, what's going on, you know, why are we not getting consistency with the autologous, you know, technologies. And so that's why we're bringing on some of these other modalities where you see a little more consistency with the regeneration.
Got it. Okay, so you're bringing kind of the treatments on that you're seeing more consistent results, one that you've had success with. And would you say that regenerative medicine is basically using your own body's healing capacities to treat yourself naturally?
Well, that's one modality, like she was talking about. So that's using your own blood with like PRF, PRP, platelet rich fibrin. But as she was saying, like not everybody has the best PRF or PRP. So that's when you have to kind of take a look at, you know, your specific patient. Are they really healthy? Are they hydrated? Do they have any, you know, chronic illnesses that is going to not allow them to have the autologous regeneration, and you're not going to get the best results? So then in those cases, we really want to think about switching to more of like the REScence or like the Sculptra and stuff like that. So it really is patient specific. And you really have to, excuse me, educate your patients, because that's really where a lot of these decisions come in, because that's what we pride ourselves a lot on too, is patient education. So we have a lot of patients, they've had work done, you know, but they don't know why. They don't know what products to use. They're just go in and they're like, yeah, my provider just said this. But we really do want to make sure that our patients sit down, they have all the information they can have, and actually we can come up with the treatment together. So yeah, sometimes the PRF, PRP is a really great choice for them. Sometimes, we're like, you know what, we really think you need to kind of switch modalities in order for you to get the best benefit.
Got it. Okay. Now, I want to dive a little bit deeper into really what differentiates your practice from others in the industry. I think we kind of touched on that in that last question, is you're bringing on these other treatments, you're doing a more personalized approach, really based on the individual and how they react to these different modalities. But could you share a little bit more about what makes you different, maybe the vision you have of the practice and really how you operate? If you could talk a little bit more about that.
Yeah, so I think we really believe that we are one of the highest standards in the Omaha, Elkhorn, Nebraska area. We are a luxury med spa. We spend a lot of time, money, and education to make sure we provide the best. And so we don't discount services. We don't do a lot of sales because we've taken the time and finances to really make sure we are the best. And there's a lot of great injectors in the area for sure, but we also, every single consultation we have is 45 minutes long, no matter what, no matter if they want treatment that day or not. And that gives us a chance to sit down with our patients and really build trust and start that relationship, because hopefully it's not a one-time treatment. Hopefully this is a 10, 15, 20-year journey between both of us. And so we spend a lot of time with our patients on education, and we try not to pump people in and out quickly. So ours is more quality patient care than quantity, I would say.
Oh, yeah, 100%. And, we really want, our place is beautiful. We don't just do injectables. We have a day spa side. We've got massages. We have an outdoor seating area. So we wanted to really feel like this is a place where they can come. It's like a community. And like Megan said, it's very important to us that we really build trust and really great relationships with our clients. I mean, we have clients that come in and they just, they tell us about their day. We know about their families. They know we can pick up if they're having a hard day, And but the biggest thing is also we practice more natural, because I can't tell you how many clients that we have come in and out, and like, I don't want my lips to look like fish, or I don't want to be overfilled. And here's the deal, like, we don't want you to have that either. And that's where the education comes in. It's not the product, it's your injector. So if you come out looking overfilled, overdone, it's not a product issue. It's you have an injector that is giving sometimes what the patient wants versus what aesthetically looks good. So we definitely, there's a big trust value, and we want you to look like you, but just a more younger, fresher version of yourself. So we tend to practice a little more natural and just like enhance your own features that you have.
Got it. Now, I'm starting to see more and more people, or this shift of people wanting to look for more natural looks. There's no longer the idea of, wanting to be done up and all that. So what do you think it was that led in this shift to people wanting to have more of that natural look?
I think a couple bad cases that got publicized, maybe, that kind of went rogue on probably social media like TikTok, and celebrities get put in the spotlight, and even they're human too. Their injectors are human. We make mistakes. There are sometimes undesired outcomes that we've had with, even injectables. Mm-hmm. And I think the unfortunate part is somebody ran with, a couple bad cases. And so that has really put kind of like a negative spin on injectables. But at the same time, it gives us a really cool platform to re-educate people on the natural outcome, because even a few years ago, I feel like people wanted these like big giant lips, and their lips couldn't hold that type of product. And we were seeing migration all outside the lips. And I probably did it to a couple patients as well, because that's what they wanted. They wanted bigger, fuller lips. And then years down the road, we start to see migration, and we start to see undesired outcome. And so I think it's a good and a bad thing. So hopefully we're just going to run with the good and re-educate people on what natural enhancement with filler looks like.
Okay, got it. Now, I want to talk a little bit more about the education side, because you did talk a lot about this kind of throughout this interview so far, where you invest in your own education, how you want to educate your clients. So could you talk a little bit deeper about how you view or even how you approach education for yourselves, but also for your clients, particularly when it comes to the services that you offer and the benefits that come along with it?
Yeah, sure. So, especially education for ourselves, like Megan and I, whenever we can have like any sort of like advanced training, especially when it comes to injectables, we are always on board. Even though we have taken multiple like master level courses, there's always something that you can learn. There's always new injection techniques coming out. We've definitely had some like, yeah, we didn't probably learn a whole lot that we already knew, but then we've had some that come like, oh my God, this person was amazing. So it becomes more of a collaboration as you kind of get to that kind of higher level, and knowing that you don't always know everything. Like as soon as you become complacent and think that you know everything there is to know, I think is where the downfall can be, because there's always something that you can learn. There's always like
and boring.
Yeah. So there's always, you can always learn, you can always do better. And we really pride ourselves on making sure that we are up to date on all the newest things that are coming out, that we are injecting safely and in the right plane, and that can be really difficult sometimes. And just making sure that we really know what we are doing, not just for ourselves, but that our clients actually can come in and really trust us. And when we come in, like I said, it's very important that if I go in for a medical procedure, I want to know why. Why do I need this? What is happening? What are my outcomes? And I think that's what builds also patient relation trust, that we really do know what we're doing, and we really do want them to understand why we recommend this, or what's going to happen with their skin, and why it's going to take, like 3 to 6 months to achieve like the best results.
Yeah. So we bring our patients in, we have, not only before and after photos, but we draw on their face. We show where fat pads are starting to melt, where they're starting to split apart, where they're starting to get static line, where they have their skin laxity. We'll draw all over their faces. We usually try to send them away with, what we discussed. We're nurses at heart, so we're used to writing care plans, and that's still what we do. And then, in our charting system, we have it all laid out. So the next, what are the next steps? And at that appointment, we either do a treatment or we don't. And at the future appointments, it's like, okay, this is what we discussed next. Now it's time to, get this on the books, so they always know what's next. They're not coming to us. We are basically laying it out there for them.
Got it. Now, within that vein of education, I'm sure you get a lot of clients that come and have some misconceptions about the treatments you provide or what you do. So could you share some of the common misconceptions that you most oftenly hear?
I would say the main ones are overfilling. They say they don't want their face to look fat. And that's a huge misconception, because we know that it takes a lot of product to really change angles and angles of the face. So I think when we're talking like a couple cc's of product, like 2-3 mLs, they're like, whoa, that sounds like a lot, when in reality we know to do a whole face it could take upwards of 10 syringes at some point. So I think I hear that a lot, like I don't want my cheeks to look fat, is something I hear a lot.
Yeah, and just especially when it comes to build your own natural collagen, when it comes to like laser work, I think people think that it's like one treatment and it's done. And it's not the case. It's going to take, especially when it comes like stimulating like your own natural collagen by doing like microneedling or radio frequency microneedling or any other anti-aging laser, it's going to take at least a series of 3. So my thing I always tell my clients is I have a magic wand, but it's waved over the course of 3 to 6 months. So these things take time. And the only instant thing is filler. So yeah, so like Megan said, like, people are like, oh, well, I have this problem here. So they just think that it's one problem. Well, it's not. You have to actually attack it from back here and back here. So I just think, I think that's probably, like you said, the biggest misconception.
I think another new one that I'm hearing a lot lately is about plastic surgery. because it's becoming, even like eyelid surgeries. I think that's probably on trend this year, blepharoplasties. But there's like a duel between like plastic surgeons that don't believe in filler and laser work, and then there's ones that have it incorporated into their practice. And so we have a lot of men and women that come in and they think, okay, if I put filler in my face or if I do this, is it going to affect my facelift in the future? And there are conflicting, which I can't speak to that level because I'm not a facial plastic surgeon, but I've heard and listened to both sides. And so I think finding that ground where, maybe somebody's not ready for a facelift yet, but still wants to look younger, just finding that collaboration between those two practices, I think, is becoming more important.
Got it. Now, I want to understand how you view creativity in your line of work, because when people think about medicine, they think that there's a step-by-step protocol, there's a procedure. You really shouldn't try and get too creative, but in aesthetic medicine, that can be very, very different. So what role do you believe creativity plays in how you approach your client care?
Yeah, I love this question because especially with neuromodulators, we've been playing with full face injections with neuromodulators. And so, when we first start, we just have like a standard that we follow, right? It's like dot, 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 it's kind of like a standard protocol. Well, now we know, we've known for a while, but basically elevator and depressor muscles of the face, right? So I know if maybe I inject here, I can get things to lower here, but if I don't inject here, I can get things to elevate out here. So playing with injection patterns has been kind of cool artistically. And, but there's also that educational piece where you say, okay, like we're going to try this, but I want you to come back in 2 weeks so we can really see what the outcome looks like in case, we make your brow arch too much, which I've done that too, but I think playing with the tug of war between the facial muscles has been really cool. For me this year, I just feel like it really clicked. And so that's been kind of fun for me.
Yeah, because it's always some sort of experiment too, because I always tell my clients, like, I could treat you and I could treat your twin sister and I could have two totally different outcomes, especially when it comes to neuromodulators. And I think another part of the creativity that we've been working with are what we talked about earlier, some of the all the new anti-aging things between the PDGF and the PRP. And then we brought something on this last year called the mermaid facial, which is some mesotherapy with a few different products. And then we're like, okay, can we combine maybe microneedling with Sculptra and trying to figure out how many different modalities we can actually combine in one treatment to really get that boom, that effective result. So being creative is actually something that's very fun that we can do.
Okay, awesome. Now, throughout your entire careers, I'm sure that you've run across some really challenging cases that have come across your door. So is there maybe one story that really stands out in your mind of a tough case that came in and really how you were able to get them a successful outcome in the end?
Oh boy, I think we've had quite a few of those throughout the years. I would probably say actually one of the toughest, and this really doesn't have to do a lot with like the outcomes of themselves. One of the toughest things to do is when you have a client that comes in and no matter what you do, they are not happy. We can show them befores and afters and they're like, I just don't see it. I don't see this. I think that's probably one of the toughest things to kind of get through, because then it comes back to talking about them. Okay, so is it something on the outside that you're feeling versus something on the inside about yourself that you're not seeing, So it depends on and that's why building a relationship with your client is so important too. So you can have some of those conversations like, well, what is it that you're seeing, that I have not provided for you? And really trying to, because at the end of the day, it's happy and we truly do care and genuinely love our clients that come in. I mean, they can go anywhere, they can spend their money anywhere, but they're choosing to come to us. They're choosing to put their faith in us. I mean, this is their face. This is their outward appearance, So I would say for me, sometimes that's some of the tougher ones. But I think some of my most favorite ones are when we do a complete Like, I mean, I don't exaggerate when I say that we've taken 10 years off of people's faces. And it's a lot of time. It's a lot of trust that these clients have to have in us. And my favorite, and I can probably speak for Megan too, is when they look in the mirror and they start crying because they feel so good about themselves and they're so grateful. And it's just, it's so rewarding.
Yeah, that's pretty cool.
Nice. Okay. Yeah, I think it's always tough because sometimes you get those people that they don't see the changes, or they just have like a different viewpoint of how they see themselves. So no matter what you do, it's just they're never gonna be able to break that mindset they have of themselves.
Yeah, it's usually psychological, like she was saying, maybe a little dysmorphia. But I think another hard one for me is, people that have hopped around to a lot of providers are getting, the aesthetic industry is hard because it's not black and white. It's very gray. And I feel like most medicine is like that. But I think now that it's gaining more attention, there is a scope of practice and a standard that has to be held. But we know in some states still, you only have to have a certain education level to be an injector. And so when you're talking to an esthetician versus, a nurse practitioner or an MD, you're getting varying levels of expertise. And I guess I take that back, because there could be an esthetician that's very well educated too. It's just you're getting pearls from different people, and sometimes they all don't make sense. Like when they come to us and you're trying to, I guess, educate on what our viewpoint is, and they've already gotten education elsewhere. And so then they feel really conflicted, like, well, what's right and what's wrong,
Okay. Yeah, I think that's a great way to share that, because there's a lot of misinformation and confusion in the market, especially now with social media, and people think that, oh, this is natural, I can get this, but it's all filters and done up. But
For sure.
I think it's important to, again, going back to the education side, sharing people what can be done for them personally and specifically. Now,
right. We get a lot of our clients that will text us or show us pictures like, oh, what is this? Can we do this? And I'm like, well, we have that, but it's called this. So there's also a lot of different modalities that do the same thing. So people, like, especially if it's trending on social media, oh, you have to have this service. I'm like, well, no, because this is the service what we do, and it's the same thing. So a lot of these modalities can kind of cross over. They have different names for them, and that can become really confusing for our clients too.
Yeah. Okay. Got it. Now, Angela and Megan, where do you think the future of aesthetics is going?
Oh gosh. I think I'm seeing a lot more internal med playing into all this with peptides. We've kind of ebbed and flowed through fixing our insides, like your gut and internal health. And I think figuring out cellular regeneration with, like, whether it's NAD or, there's a million out there, and I'm not well versed in them, but I've even started playing with some different peptides, just to not only like look better, but feel better too. So I think regeneration and biostimulation is where it's at, especially with the negative spin on filler lately. I think that'll come back around, and there's still definitely a need for it. But I think, biohacking, just figuring out our bodies and how we can look and feel our best, through diet, exercise, peptides, etc.
Yeah, 100% agree with her. And I do think that people, like we kind of touched on earlier, we do love injectables and fillers, but it's not the end all be all. Like, you have to do the biostimulation, the laser work. And I think like we talked about earlier, again, it's trending more towards a natural look, like more like natural lips, natural facial features, regenerating your own collagen versus always using, injectables. So I'm honestly thrilled to start to see it go this way, because this is the way that we've actually always practiced.
And actually taking care of the topical skin. So people will come in and spend thousands and thousands on injectables, but then they won't touch skincare. And it's like, you're gonna pull your hair out, because it's like, no, you can use this on your skin every single day. This is your protection. This is your anti-aging. This is your antioxidant, and and they want instant gratification. And I think people are seeing a more long-term goal with like the epidermis and the top layers of skin. So that's really cool too, because if your upper layers of skin don't look good, then filler it really isn't going to look good, you know?
Yeah.
Okay.
Yeah, I always tell my clients, if you have a budget with skincare or a neurotoxin, I'm telling you skincare hands down. Yep.
Okay, awesome. Well, thank you for sharing that. Now, I have one last question for you, but before I ask it, I want to point people to your website at sakunthespa.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure or treatment done, but isn't sure which provider to choose?
I would say just do your research. You know what I mean? And maybe if you are not sure, get a couple of different opinions, you know, and you will find that provider that you click with. You know, Megan and I have been working together for so long. We have clients that will see both of us. We have clients that have started with me who moved to her, or vice versa. It's just, it really depends on you. Once you get into that chair, you have to feel comfortable with whoever you're sitting with. And there are Google reviews. You definitely want to kind of research. If people post befores and afters, look at their work. See, is this the type of work that I want to be, or does this provider specifically with their befores and afters am I more attracted to those? So that's the best advice I can give.
Yeah, and I definitely think it's important to go meet your provider too. You know, that's why we do 45-minute consults and it works both ways. Sometimes there's a patient who's that I don't want to take care of. You know, they don't fit like what my ultimate end goals are either. So it's it goes both ways, but I would say go get a couple consults before you're thinking about anything and check out the space and the energy. It's what I've done with a lot of things in my life, you know, when I'm making big decisions, you know?
Yeah. And like she said, like if they're not comfortable with us, then we, you know what I mean? That we're probably, if the client's not comfortable with us, we are probably not going to give them the outcomes that they desire.
Okay.
And that's okay. We know we're not for everybody.
Yeah. You got to attract your tribe, right? And then everyone else can go to your competition, especially all the problem ones.
Yeah.
Well, there you have it, Angela and Megan sharing their expertise. Now, Angela and Megan, where can people contact you in your practice?
So you can either call Sakun the Spa. Do you give the phone number?
Oh yeah. Megan's worked here for 6 years, but you know, yeah, our number is 531-466-8200. Megan and I also both have social media accounts. You can directly go to our accounts. You can direct message us. We do that a lot. We communicate a lot that way through our clients as well. Or you can just go to the website as well, sakunthespa.com.
Okay, awesome. Well, thanks for being on the show and sharing your message.
Thank you.
Thank you so much.
For taking the time. Appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.